Morena, talofa lava malo e lele. Good morning, everyone. Welcome to Center of Balance Life. My name is Kenny, the acupuncturist and Chinese medicine herbalist from Center of Balance. Today's topic is about bedwetting and which acupressure points could be helpful for this type of conditions. Please like and share or tag those that could be benefit from our daily topic. Do you or do you know anyone who suffer from bedwetting? If you do, please reply 1 and definitely save this topic. Let's get one of these 3 tools ready. It could be your finger, either your thumb, your index finger, or your middle finger. But make sure you cut your nails when you do acupressure points with your fingers. Second tool can be your knuckle, which is where your index finger will be bending down and with your thumb underneath it to support it. 3, a massage device or some small rounded tool, not too sharp please. So what is bedwetting? Bedwetting refers to the involuntary discharge of urine or loss of bladder control during the night. The medical term is nocturnal enuresis. Bedwetting can be an uncomfortable issue, but in many cases it is perfectly normal. Enuresis is a typical developmental stage for some children. May very well be more of a temporary inconvenience than a medical issue. As the child grows, the bladder naturally strengthens, resulting in fewer bedwetting incidences. It often takes until a child between 5 and 7 years old before they develop better bladder control. Some may have this problem until puberty. It doesn't just happen to children, it can also affect adults and could well be a symptom of underlying medical condition due to a variety of causes and of course may require medical attention. So what causes enuresis? Enuresis may be an inevitable part of growing up, as we mentioned before. As a parent, it's better to have an understanding of the triggers, talk and support the children instead of making it a traumatic experience for them, especially on the psychological side of it, such as giving up punishment or embarrassment, lead to loss of self-esteem, feeling of shame, guilt or humiliation for the child. Physical condition can also lead to some people having bedwetting. Common triggers of children and adults having bedwetting include, for children, small bladder size. Children under the age of 5, the smaller bladder size can cause the child to wet the bed as their bladder may not be developed enough to hold urine produced during the night. Hormone imbalances. Our body produces sufficient antidiuretic hormone, also known as ADH, during the night to suppress the kidney function or the kidney activity to slow down the production of urine at night. The lower volume of urine helps a normal bladder hold urine overnight. However, some may not produce enough ADH to slow the nighttime urination production. Diabetes, another disorder that can cause as the body unable to process glucose properly and may produce larger amount of urine. The urine production increase can cause both children and adults who normally stay dry overnight to wet the bed. Other causes such as bladder cancer, UTI, which is urinary tract infection, neurological problems such as post-strokes, emotional problems such as stress, fear or insecurity, prostate gland enlargement, sleep apnea or abnormal pauses in the breathing during sleep, constipation. Possible risk factor that may cause the bedwetting also include can be a family history or genetically, such as parents or sibling had bedwetting as children. It may play a role. Children with ADHD, which is attention deficit hyperactivity disorder, may also at risk of bedwetting. According to traditional Chinese medicine theory, enuresis is a disorder of water metabolism. The three main meridians that create, control, and release of urine are the lungs, spleens, and kidneys. Kidneys control the growth and development according to Chinese medicine, where spleen plays an important role in terms of fluid development, as spleen is the root where the problem with the fluid starts, and the lung is where it is collected. Enuresis is usually explained in traditional Chinese medicine as a deficiency of the energy or one or more of these organs. Heart and liver meridian may also play a part. Other potential causes could due to the weakness and coldness of the lower limbs or lower units, or retention of dampness and heat in the liver meridian that may lead to dysfunction of the bladder, causing enuresis according to Chinese medicine. So what can we do, or what are the acupoints that you could use to help? Please don't forget to like and share or tag the people that can benefit from this video. So the first acupressure point is on our belly first, okay? It's on the midline of the body, 4 fingers below the belly button. So first you have to locate your belly button and place 4 fingers. Of course, this is not to the proportion. 4 fingers, and on the same line there, you locate the point or something sensitive around there or tender. So you just press and rub 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then you release. Okay, so make sure you locate your belly. This is where my belly is, and 4 of your fingers placed there, and of course it's on the midline. So this is where the point is. Okay, 4 fingers down from the belly. So you can palpate around and find a tender spot or sensitive spot, and just give that location or that point a rub of 10 times. Okay, and then you release, you rub again 10 times, release, rub again. Okay, you can do that 10 times, or you can count to 30 seconds. The next point is on our palm. So you find between your middle and the ring finger on our palm here, between a middle ring finger. So this is a ring finger, this is the middle finger, this is ring finger, just between it, and it's located between the bone. So you can rub around this area, you find a tender spot or sensitive spot, give that area a press and rub 10 times. Okay, and then release, and then you go again, rub that 10 times, or you can count up to 30 seconds. Again, the next point is on the palm again. Okay, this time around you start just along the middle finger, okay, all the way down, basically almost to your wrist. Okay, so you can start from here. This time I'm going to use my thumb. Okay, just give this area a press. Okay, find the most sensitive spot or tender spot, and then press and rub 10 times. Release, press and rub again. Okay, so make sure you rub along the middle finger all the way down almost to your wrist. Okay, and then you go in your ring finger side, same thing. You start here, just below the finger, and you go all the way down to press and find the sensitive spot and give that area a rub 10 times. Count to 10 or count up to 30 seconds. Okay, release and repeat again. Okay, there you go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, shoot middle finger and ring finger along these two lines all the way down to the wrist. Next point, the traditional points, is on the anterior aspect of our lower leg. So, show you 4 fingers with below the kneecap. You locate your kneecap first, and then you place 4 fingers just below the kneecap, 1 finger breadth from the shin bone. Okay, 1 finger, 4 fingers, and then 1 finger across. Use your thumb, your knuckle, or massage device. Press and rub 10 times or up to 30 seconds, and then you release. Go again 10 times and then release. You do that 3 sets, please. The next one is on the medial side of our lower leg. Okay, 3 fingers, just basically place 4 fingers above the highest point of the ankle. So make sure you find the inside of your leg, the highest point of the ankle, and then you place 4 fingers. This point is located just behind the bone, within this area. You press and find the most sensitive spot. Give that spot a rub up to 30 seconds. Then you release. Go again. Release. Okay. The last point, this time, same thing, is on the inner side of the leg. Now this time it's lower down, just behind our ankle. Okay. You find the highest point on the ankle and the Achilles tendon. You divide them in half. Okay. Within this area, give this point or sensitive spot a rub up to 10 times or up to 30 seconds, and then you release. You go again. Release. Press again. Okay. Make sure you repeat this 3 times throughout the day. Of course, some of these points might not work for you. That's why it's important for us to do an initial examination with a series of questions in order to assess and identify which organ system is or are out of balance. So please don't hesitate to call us or email us info@balancetcm.co.nz to book an appointment, or check out our website www.balancetcm.co.nz. If you are outside of New Zealand, don't worry. As long as you have internet, we offer online Zoom consultation, simply because we love what we do. My name is Kenny. That is all from me today. If you like or enjoyed our daily life, please give us a thumbs up, like and share. Thank you for joining us. Looking forward to seeing you guys again. I love to you all. Stay awesome. Ka kite ana.